All right, so welcome. Thank you so much for joining us. I really appreciate everyone being patient as we got started here. Um, Please, as folks come in, please feel free to continue to use the chat in order to like introduce each other. And yeah, we're going to hopefully have a lot of good conversation. Uh-oh. All right, so welcome to the Engage and Adapt webinar series. This is a space where we want to practice lifting our voice in advocacy as well as using our hands to help. Um, we are living through a lot of very rapid changes, a lot of very drastic changes. And so we want to make sure that we are providing a space for people to come together, learn how they can make sure that they are voicing the things that are concerning to them, to the people who are making decisions, but also make sure that we are working with the people who are directly affected in order to make sure that they have everything that they need as things continue to change. All right, so I'm going to introduce myself. My name is Chad Stanton. I'm the political director here at Sojo Action. I'm originally from Dallas, Texas, and I'm going to go ahead and kick it to Reverend Harris, our senior director of programs.
Good evening, everyone. I'm Reverend Moya Harris, and I'm so excited to be in conversation with you guys. And I'm the Senior Director of Programs, been at Sojo this past weekend for 5 years. So, yeah.
So, just a little bit about ourselves. I can say why I'm passionate about this work. Having grown up in Dallas and seeing a lot of the things that seemingly were very unfair, especially particularly in a city that is such a city that values its communities of faith. Really struck me as something that was something that we really should do something about. And so that kind of led me on the path to studying government at the University of Texas at Austin, working with Congresswoman Eddie Bernice Johnson, and then eventually finding my way here at Sojo Action, where I'm really hoping that we can create an impact to change the things that seemingly go against our moral code and strictures.
Yeah, and my passion for this work, my parents are from the civil rights era, grew up in Mississippi. I've always had justice and equity in my blood. So I'm here today to help people whose voices are not being heard to be equipped, especially during this time, because things are crazy. So I'm just living out, as Dr. Katie Cannon would say, I'm doing the work that my soul must have. So I'm glad to be here.
Yes. And so just wanted to make sure that people understand that Sojo Action is the advocacy and mobilizing arm of Sojourners. And we are happy to join you in this mission of making sure that we are putting our words into action and bringing our faith to bear. All right, so we're going to discuss recent policy changes, most of them centered around the One Big Beautiful Bill Act that was passed in the House and Senate and signed into law by President Trump. What they mean, what those policy changes mean for the people we care about, and then also how we can discuss how we can engage with decision makers on the changes as they are being rolled out, things that we may want to see changed in policy moving forward. And then we'll also discuss the ways we can help the people in our communities who are going to be directly affected. So just wanted to pause there for some level setting. If there's any questions, comments, concerns, please feel free to put them in the chat and wanted to make sure that we are able to answer those as we go through. Tom from LA, thank you for joining, even if only briefly. Uh-oh, backwards. All right, so where are we? Oh, sorry. Where are we? With recent votes, we've seen Congress make changes to programs that are vital to our communities. In particular, Medicaid and SNAP are two programs that provide things that are vital, like healthcare and food, to people who are in need. Um, Things that we've seen changed at the federal level is the requirement for additional reporting for work requirements, as well as reporting requirements for people who are receiving benefits in order to have access to them. These changes may look different for people in different states as these are state administered programs. So these are federal guidelines that are supposed to spur states to be creative in the ways in which they apply them, which gives us an opportunity to intervene in the process in order to make sure states are applying them as well as they can to minimize harm to the community, which is why we also want to make sure we are advocating then. But as these changes are being implemented and as they are being discussed, we also want to make sure we're talking to our federal legislators at as they're back home for their August recess sessions, so that they understand the things that we want to see moving forward in budget negotiations and in writing the regulations for this legislation. Um, we know that we can engage with decision makers to help shape what the process may look like. And so we want to make sure we're being informed while we do so. And we want to make sure as many people are engaged in the process as possible.
Yes, and so throughout scripture, we're asked to speak for the poor and the vulnerable. Proverbs 31, 8 and 9 demands that we speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and needy. Psalm 82, 3 and 4 calls for us to defend the weak and the fatherless, uphold the cause of the poor and the oppressed, rescue the weak and the needy, deliver them from the hand of the wicked. And I even threw another one in there. Isaiah 1 and 17 says, learn to do good, seek justice, rescue the oppressed, defend the orphan, plead for the widow. These are just some of the words that speak to how the faithful should, us faithful folks, should advocate for those whose voices are not being heard.
Thank you. And so I want to ask, as we continue to think through our moral obligations, and think through what does engaging look like, if either in the chat or you can raise your hand and bring your voice into the room, just a few series of questions. The first being, what does engaging mean to you? And so you can feel free to add it in the chat, voice it in the room, contacting legislatures. Says STFA big. Engaging includes speaking and acting towards justice, being personally involved in the issues, nonviolent resistance, contacting legislators. These are good answers. Thank you all. Yes, engaging can mean contacting legislators, making sure our voices are heard. Um, Also making sure we understand what's going on and staying up to date on the most recent up issues, and also talking to our community members in order to make sure that they have an understanding of what's happening as well. So these are all really great answers. And there's a variety of ways in which people can engage. And so I think that's one of the things that we want to make sure that we remember as we are continuing to think through how our public witness affects those in power. Another question I want to ask is when you are engaging, what does it look like? What does it look like when you are engaging? Also, like Luke's answer of saying something like the prophets. And so this can mean engaging with people in this process. It can mean engaging with people in your community, doing and not watching. That's a good answer. Thank you, Mary Lou. Leading a Just Faith small group at my parish on immigration. That's also a really good answer. Reaching out to people who have the best wisdom, checking in with the local church on the migrant legals team. It seems thinking and thinking isn't getting me too far. I understand that too, Tom. I can sometimes suffer from paralysis by analysis myself. Hopefully we're going to be able to kind of provide some of the tools that people need in order to prevent that. I really appreciate that. All right, so let's move to the third question.
Can I share
Um,
one real quick?
oh yes, please, Reverend Moy.
Sure, sure. When someone's engaging with me, I feel like they're looking at me. They're engaged in active listening and they're trying to get to know who I am. Instead of I'm not just a number, but they actually care that there's some needs that are not being met.
That's awesome. And that leads right into like when people are engaging with you, what are the things that you notice, either in conversation or about something that they're passionate about?
I read that second one wrong. My bad.
No, it's okay. It's the perfect transition.
See, I gave y'all the answer, but there's more. There's more.
Yeah,
What else you see?
yeah. What the Reverend just said is a good answer. All right, let's move to the next slide. But I appreciate everybody dropping their answers into the chat.
So engaging. It's important to tell our elected officials and community leaders how we feel. Our voices matter, especially when lifted with clarity and conviction and care. Our voices and our stories are important parts of the way people understand what's happening around them. This is how we shape meaning. This is how we understand our world. We carry the stories of our grandmothers and our grandfathers who stretched one meal into three. We think about our ancestral reality when we are engaged of people who have gone through this before. What is it that we can do now? It's essential to be thoughtful with how we use the trust that is given to us, especially as clergy. When we're interacting in the community and as clergy, it's like if anybody's clergy on the line, if you walk around with a collar, people treat you differently. So we ought to be thoughtful for how we engage with civic leaders as we go.
Thank you. And so in thinking through this process, wanting to highlight that during the month of August, members of the House and Senate are back in their districts, back in their home states. And it's a perfect time in order to use your voice in order to make sure that the concerns that you have around particular issues is heard. So today we're going to be discussing Medicaid and SNAP, but this also applies to concerns around like immigration funding and budgeting, things that are going on internationally as well. Um, Having worked within a congressional office, working for Congresswoman Ada Bernice Johnson, um, working in constituent services office, I can say that when people came into our offices there in the district, it carried that much more weight. And the member listened and was intent on understanding what was happening that much more, because that's way they understood and knew that this wasn't just something that was being put forward by a lobbying group in DC that's very sophisticated, but this is something that people were passionate about. They took time out in the middle of their day during the week in order to come and talk to either a staffer or the member themselves, and so they really sat up and paid attention when that happened. And we need people to show up in that way in this moment in time, as a lot of critical programs are under the gun. So in order to do that, you can call or email your local member of Congress, and we can make sure to share with you a tool in order to find and locate your local member or your senator, and ask to speak to them or a member of their staff in order to discuss some of the concerns that you are worried about. Some of these members may have their policy staffers in DC who may not be able to come in person, but a lot of offices are using technology such as Zoom, and which we're using today, and you can even, ask for a conference call in order to make sure that you're talking to the relevant person who handles the issue that you are concerned about. And we want to make sure that you share where you live and what issues are important and why they're important to you when you're asking. So, for example, if I wanted to set up a meeting with my local member, I would say, I would call, say, hello, my name is Chad. I'd like to schedule some time with the member of the staff to discuss recent changes from Medicaid. Um, when we're talking, we want to make sure we are using reliable information. A lot of this information, people within these offices may not have been exposed to or had access to beforehand. A lot of the stuff may be local reporting that they just may not have been aware of. So we just want to make sure we're using as accurate information as possible. But the main thing we want to do is make sure we emphasize our moral commitment to helping people. Um, it's very easy to get caught up in the details and minutia of a lot of these bills, but you want to make sure that you understand that the office walks away with the understanding that the bedrock commitment is to making sure people have the things that they need in order to live. Yeah, I'll kick it to Moy.
So, as people of faith, we have a moral call. We are called to stand in the gap, to bridge the gap, especially when systems overlook or push people aside and harm people. These changes threaten to block access to the very programs that help our communities breathe, heal, and thrive. So we're leaning into our shared commitment to care, not just in word, but in witness, as we raise our voices and engage civic leaders in this moment of urgent need. And I'm just going to pause here as people of faith, where the message has been a little bit different. It's important for all people of faith to have their voices heard by their elected officials. It doesn't matter if they're liberal or conservative. We need to speak up, period. So what am I really saying? This isn't just about politics. We want to emphasize everyone's right to dignity, making sure our communities have the resources they need for everyone without too much burden. We want people to be able to thrive, not just exist. Any shared faith that emphasizes the demand to provide for people who are without. That's like, I mean, let me say that in a different way. So the politics are the way our government allocates resources, right? They set priorities and decide and make agendas, and they decide who is worthy of care. Agendas and policies are both sacred and secular. They're moral documents. And because of how we deal with political things is a reflection of how we envision God and how we see each other. So how we show up, even if somebody's liberal, even if somebody's conservative, even if we're an independent, it doesn't matter. All of that. And this is a nonpartisan webinar. Politics is a mirror of our theology. We only honor the divine in people. Do we? This is the question I want to ask you. Do we only honor the divine in people who look, live, love, and think like us? Or do we recognize the sacred in every human being, especially those our society pushes to the margins? Those are the questions that are before us that we should have in our mind when we look at the policies that have been set before us.
Yeah, yeah, exactly. It's kind of hard to follow, Reverend Moore. But in this really leans into your particular context, right? So I'm really glad, Tom, that you mentioned that you live in a liberal district. I think it's really important, even if we think that people are in agreement with us, that we also provide and lift our voices there so that they have some of those personal stories, some of those personal anecdotes, some of those things that they know they can convince others with once they go back into the rooms that they need to in order to have the conversations they need in order to move power. And so being able to say, hey, I'm not just saying this because, I'm a part of the like, let's help everybody caucus. I talked to someone within my district who made sure to emphasize to me that this was important. So I think that's a really key context as well. And so one of the best aspects of your involvement is letting people back home understand that people care about these issues at home. It's not just something on television. It's not just something that they see on their screen. It's something that's happening. Their neighbors are getting involved, and that they can get involved too, right? And in this way, we can set the example that people can follow in order to make sure we are expressing our moral dignity in the way that we need to. And so, with that in mind, I do want to ask, with these recent changes, what are some of the things that are particular to your community that is of concern to you? And so, again, feel free to voice it in the chat. Raise your hand if you'd like to come off mute. And I really like to kind of dig down into that. As again, we are being recorded, so this will be, on the internet. So just keep that in mind as well.
How can you connect with people in your community? I hear Mr. Rogers. What do you say? Who are the people in your neighborhood? We know this stuff. I just showed my age there, but how do we get to know people, especially people that don't go to our churches or our congregations? How do we get to know people? Do we just stay home and try not to get COVID again for the 100th time? Do we go places where people are so that we can build community?
All right, Mark. In my neighborhood, uh, people that whose immigration status puts them at risk. Those are the people that I'm guessing you're saying you live into. Oh, that's what you're concerned about. Thank you, Mark. Mary, in rural Minnesota, the local hospital in my old rural area will go under without Medicaid. That is a real concern. Friends with intellectual disabilities from Rick, many of the services are funded by Medicaid. Yes, this is a real and serious issue. Yeah, loss of resources for those who won't have food, healthcare, safety, including immigrants. Thank you for these answers. I understand like these are really serious issues and very personal to people's particular communities. And so I really appreciate everyone sharing. And I do want to make sure that as people are thinking through what advocacy looks like for them, what engagement looks like for them, that they're thinking through how these particular issues need to be answered by the people who are elected by us in order to address them. And so really wanting to dig down and as we follow up with people and make visits and making sure that we are not only understanding what's happening in your community, but we're also lifting that up so that people everywhere understand that they're not alone in facing some of these things. And then yeah, let's get into we are a little bit early, so we can get into the last two questions here on how can you connect with people uh, you meet and where how else do you listen to people where you live? Joan partnering with another church to discuss social issues. That's awesome. And presently partnering with another church to discuss immigration issues. That's awesome. LGBTQ community and women's rights, those are definitely big concerns in this moment in time. And I think it's really important that we connect the way in which, removing access to healthcare for some people, removing access to food for people really exacerbates some of the issues that are particular to marginalized communities. Not having the ability to go see the doctor when you need to, make the health decisions that you need to exacerbates the ways in which people exploit and visit and harm others. So I do want to make sure that we lift that up as we're thinking. All right, well we're getting a lot here. All right, Surge is a good group to get involved in. That is a really good way to listen to people where you live. Um, Writing, attend the city directors meetings. Yes, making sure that you are participating in those aspects of democracy that aren't connected to, elections and things of that nature is very important there in order to get a good understanding of what's happening in your community and how you can affect it. So, really great answers here. Thank you, Stephen. Awesome. Let's go ahead and go to the next slide.
I want to hit that last question. Who do people listen to where you live? That's important. Like, who is the authority in your community? Who do the people trust? And how can you partner with the people who already have the ear of the people in the community so that they actually know what's going on? And that could be also social media, where people get news, all that. So just think about that too. Like in my church, the pulpit is an authority that if they say bibbity bobbity boo, they're going to say that's real. Sadly, it could be nonsense, but the power of and the authority of the pulpit means a lot. So leverage the power that you do have in your community. So, so understanding your context is the first step towards crafting a narrative that resonates, not just with policymakers or the press, but with your own people. Because our stories don't float in the abstract, they're rooted in place, shaped by history, and carried by real people with real hopes. So, I ask you to think on these questions. What are some of the things that make your community sacred or special? What makes your community special? And I invite you to go beyond your sanctuary. If anything, during COVID, we learned that the sanctuary is everywhere, right? Show was on Zoom for me. Goodness gracious. So, what are some of the things that make your community sacred or special? Put those in the chat. What is it that makes you smile when you think about home? What do you love about the people you serve, the culture that surrounds you, the spirit that holds your neighborhood together, right? What are some of the concerns you have about your community? I'm asking a lot of questions. And where do you see yourself in the larger network of your community? Where do you, like, do you feel like, I'm gonna ask this, do you feel like you have any power? Sit with that. Do you have power? Is that keeping you quiet because you feel like you don't have anything to say? Where you're from, I keep hearing diggable planets. I'm from the hip hop generation. Where I'm from, I live in a suburban area where there are a lot of it's multicultural, um, and we have no idea who is dealing with who's trying to get into low income housing. Like that's one concern because the rent is so high. So yeah, keep putting it in the chat because Jennifer, you put lack of concern, lack of commitment to the underserved in inner city. Those are some of your concerns. And these are very similar questions to the ones an organization Ruby say to ask. So look, we're all that see, this is the thing. When you hear it a million quadrillion times, people will, it's like it hits, it's like, aha, I've heard that before. So yeah, that's good stuff.
Mm.
Um, I'm concerned about people in this community losing voting rights. Yes, yes, yes. Ohio, yes, yes. And that's why we got to lean in and use our power, even in the tiny fractal ways. Doesn't have to be big.
Yeah, and that's a good oh, yeah, next step. And that we want to make sure, and I think in asking where do we see ourselves in our community, we can start to think through where do we see some of the solutions that we can enact, right? So, Deacon Emily saying relatively new to community, so have don't feel I've built up power yet, but see myself learning and connecting with established groups, doing the work and amplifying. That's great. And there's also power in being and being able to see with new eyes, right? So even if you are not someone who's established within the community, you can bring your unique perspective in order to make sure that things are happening in a way that is the best, as long as you're being respectful to the people who've also been working. Help the city get a grant for solar offset utilities at the HUD housing project. Yeah. So yeah, we're thinking through the ways in which we could build power, right? So let's think through the resources we want to take into our meetings, the resources we want to take into some of those interactions with people who are making decisions. I want to say that, you know, you want to pull information as much as you can, as much that makes sense for you. Again, we aren't walking into the meeting as researchers, right? We're not walking into the meeting as policy experts or lawyers. We're walking into these meetings as people of faith who are speaking to our moral position and the things that we need to see upheld morally, right? But we do want to make sure while doing so, we're speaking as truthfully and honestly as possible. So we want to make sure that our information is without reproach. So groups like the Center for Budget and Policy Priority have built up a well-earned and deserved reputation for very reliable information. If you're talking about things nationally, you want to use those types of groups. They may also have breakdowns at the state level. In addition to them, groups like the Urban Institute or the Brennan Center um, have been really good. Groups like the Niskanen Center that may be a little bit more on the right end of it also has are really good. The thing that you want to look for is very clear explanation of their methodology. So how did they come to the conclusions that they came to, right? If they can explain to you how they did it, that is a good sign. And then you also want to make sure that their the explanation of what it is that they're explaining is very clear. So I think the main thing I want to emphasize here is as you are reading some of the information, you want to make sure that it's clear to you so that you can explain it clearly to others and that they've explained clearly how they came to the conclusions that they've come to draw. So these are some of the things that we think through as we think through sources we want to use in our engagement because again, it's very important that we are using things accurately. And Joan, I will make sure to provide some of these resources after the webinar. Thank you for asking. Um, the second thing we want to do is make sure that we are utilizing news sources that have earned trust within our communities, right? So I'm from Dallas originally. So if I'm looking to say something or speak to something that's happening within Texas, I'm probably going to go to the Dallas Morning News or the Dallas Observer or established papers in order to make sure I'm establishing the credibility of the thing that I'm saying. And there are, even though some of the establishment papers may be a little bit more conservative than we like, if you are not a conservative, it's important to utilize, again, resources that are pretty well trusted and are pretty reliable. I think another thing we want to make sure to do is listen to civic leaders, medical leaders, and other nonprofit leaders or other people within the community that are working on the things that are important to us because they're going to have sources of knowledge that we may not have, and they're going to have experiences that we may not have, and we can bring that to bear in our engagement as well. So I think that those things are really important as we prepare to go and talk to and engage with leaders. I'm going to pause there because I just did a lot of talking. Does that make sense to folks? You can do a thumbs up. All right. Got a yes in the chat. All right. Awesome. All right. So let's jump into the next part, Medicaid.
Sure. And I think some of the reactions might be not working too. So that's why you're not getting no thumbs up. But let's go over some Medicaid. With the recent changes in this program, people will need to be careful and cognizant of the new requirements in applying and utilizing the program. Areas without a lot of healthcare options may find themselves with even fewer choices. Everyone will take on the cost of fewer people being without insurance. So if people use emergency rooms as a doctor's office, it makes the wait for everyone. It burns the system. It's not how the system is supposed to work. So here are some of the talking points, and you'll get some of this, you will get this information as well. This isn't just policy, it's personal. Recent changes to Medicaid and the Affordable Care Act related program are creating new barriers to apply for and keeping healthcare coverage. Vulnerable communities will be hit the hardest. Rural areas, neighborhoods with already limited healthcare, all of this is going to affect us. Millions will lose coverage. According to the CBO and Kaiser Family Foundation, that's another good source, it is estimated that around 10.9 million people will become uninsured due to Medicaid and Affordable Care Act marketplace cuts. 10.9. And that number jumps to nearly 16 million if enhanced Affordable Care Act subsidies expire as scheduled to do so later on this year. So we're going to all feel the impact. It's not just going to affect those that it's obvious that it's going to affect. It's going to affect everyone. I think about those that are just gotten out of college, they're off the parents' insurance, and they have a job where they can't afford insurance, so they were able to go into the marketplace and have a subsidized premium. Mm, pr Pray. But it's our sacred duty to advocate for the most vulnerable. And who is vulnerable looks different in every community. So I'm gonna pass it on to you, Chad.
Thank you. And thinking and walking through the changes in SNAP, similar to Medicaid, states are being asked to impose new requirements, and make it that will make it harder for people to get access to the food that they need. Um, these are additional work requirements for people who didn't have them beforehand, and as well as cuts in funding that's going to make it tough for states to budget out the amount of food help that people are going to need. I think it's important to emphasize at the state level, these budgets are going to be decided by folks who do not have as much access to as many resources as the federal government does, and is really going to limit the ability to help as many people as possible. So as these changes happen, more people will need access to food banks and other programs, which have already been badly overstretched in a lot of communities. There was a recent story on a food bank just recently that was overburdened within rural communities, that that will be deeply affected by the changes to SNAP. Um, we know that the additional burden alone will not stop people from access will stop people from accessing food who are otherwise eligible from it. And this is one thing that I do want to make sure to emphasize. And I think an area where we have a unique ability to push back on what can be very harmful is negative narratives that get tied to people using and accessing programs that they need in order to survive, right? Um, when I was graduating college and needed food, at for a very long time, I refused to access food resources because I felt like I wasn't the type of person that needed them, right? That was due to stigma, and I wound up going hungry many a night when I did not need to. And then, you know, feeling quite foolish later on in my career when I had to utilize food resources and realizing how much better and more productive I was when I had the ability to eat. This is something that you kind of, know inherently, but when it's actually happening, you don't realize how much hunger is affecting you. I mean, you don't realize how much your pride and the idea of shame stops you from accessing the things you need in order to live. And I think as faith leaders, we have the ability to make sure people understand that you need to do everything you can in order to make sure that you have everything you need in order to thrive. And that means accessing these public resources that we have all decided collectively that we want to offer to each other in order to make sure that people are okay. I'm going to stop here in the chat. Affects Jennifer says affects health, ability to learn and work, and mental health. These are all things that are affected by SNAP, and these are all things that we're going to need to be on the lookout for as we see these changes roll out. And so just wanted to make sure that people understand some of the changes and the way in which these changes are going to be implemented. Are going to be decided at the state level, but there's also going to be at the community level a lot of moral messaging that needs to happen in order to make sure that people are okay.
Yeah.
So,
Um, I keep thinking about the children, early childhood development. The first 1,000 days of a baby's life are the most important. That's when the brain does the most growing. And if you don't have adequate nutrition, if you don't have adequate living spaces, environment, it will affect the child for the rest of their life. And that affects our community. So Black maternal death rate is sky high in a nation, the richest nation in the world. It doesn't have to be this way. So there is a racial component to this. Demonization of people who live with their backs against the law for generations and are made to feel like they're not worthy of basic needs. So, what do we want to say? What do we want to say? What do we want to say to the folks that have the ability to make some changes? We want to express our concern with the new changes to these vital programs. We want to make sure we stay engaged as these policies are implemented to minimize harm as much as possible. We got to know what's going on. We can't put the covers over our heads. Um, we want to stay engaged. That's why we were talking about engagement at the beginning and open to discussing the community issues that are important to us and to others because we're all interconnected and understand what is important to them and us. What happens to others happens to us. Eventually, ain't gonna be nobody left but us. So I said ain't, and you're muted.
all right, so how can we say it best, right? We want to make sure we're being thankful for people for their time, any stances or positions on decisions that are important to us, right? So, um, you know, coming in if they have, did a really good job on USAID or PEPFAR, whatever the case might be, whatever policy is important to you, that you can lift up as something where you have been in agreement and they've done the right thing. That's really it's a good way to show that you're coming in good faith, and you're not just there to argue. You also want to make sure that you are starting from a space of shared values, right? Um, More likely than not, if somebody's representing your community, that means they've been able to connect with people on something in the community that people care about. And so you want to make sure that there's this space of shared understanding, shared values, in which the conversation is beginning. You want to lead with what you know and be confident in your morals and in your stance, right? And a lot of the time, people can start to feel intimidated or maybe feel as if they may not know enough in order to speak. But we want to make sure that we have all the resources and we want to make sure that we are giving you all the resources you need in order to be confident in what it is that you're saying. And then also understand that at the bottom of the message, at the bedrock of our message, is a moral component that is not something that is negotiable for us. We have to make sure that people have the things they need in order to live. And then you also want to make sure to listen actively for new information or possibilities. If they say, "Hey, we might pass a fix for that," or "Hey, there's going to be an upcoming decision that affects that," then we want to make sure that we have that information so that we can be as prepared as possible in order to try and affect those things. And then we also want to make sure how they see these changes being implemented, make sure that they are paying attention as these changes are being implemented, right? And so not only keeping them on their toes, but also making sure that we have as much information as we possibly uh, can. And then we definitely want to ask, what are the alternatives they see to addressing these issues? Um, Oftentimes when talking to people who make decisions, they will leave it into the air or leave it up to you to try and come up with solutions to the problems that they're paid in order to fix, right? And while you may have ideas and those can be great, it is their job in order to fix it. And so if they say that they don't want to see something happen within the community, and you say you don't want to see something happen within the community, you may offer up your answers and they may be the correct ones, but they also need to have answers of their own. And we want to kind of make sure to emphasize that in a way as respectfully as possible. Um, so I want to pause there because that was a lot of talking. Does that make sense for folks? And so once we wrap here, thank you. I appreciate that. Once we wrap here, we're going to make sure to send you all a link to forms for anybody who's taking visits with decision makers, and so that we can make sure we are capturing that data and coaching folks through any visits that they may want to take or plan. And then we're also going to make sure that people have access to our Mighty Networks network where people can continue to have this conversation online and we can share information as we continue to work through and try and make sure that we are lifting up our voice in the ways that we can. If that makes sense with folks, we'll make sure to send those links so that you can have those after this presentation. Oh, yeah, that's what I just said here. All right.
Oh
So
yeah,
we're
that's
going
what
to have,
you said. Like, that's what you just said.
yeah.
That's
All
you.
right.
Okay. All right. So moving directly, um, throughout scripture, we are met with examples of people taking direct action to intervene when they see or know something is to be unjust. I go to the beginning of Exodus. We see the midwives, Shiphrah and Puah, two midwives, mm, to subvert Pharaoh's genocidal decree because he wanted all the baby boys to be killed when they're born. That's holy resistance. And then Moses' mother steps in, hides her baby after he's born, and starts making noise and places him in the river, doing what she can to preserve his life. And then Miriam, his sister, she watches to see what's going to happen and shapes the steps of Moses's ability to exist. None of them had power in the traditional sense. They didn't have the power of Pharaoh. But also, I would also say Pharaoh's um, daughter had power because she didn't have to take the baby out the water. And then, so all the things that we think mean that is power. Courage is power. Speaking up is power. Showing up is power. They moved directly to protect life. And that's the lineage we come from as people of faith. And this is the kind of faithful action we're called to do right now. When systems fail, when laws harm, and when our people are at risk, we have to speak up.
So while it's important to address elected leaders and other decision makers who can make changes to the policies we need, we also want to make sure we're doing everything we can to hold and help people who are being affected by these policies, right? We don't want to lose sight of the actual people who are being affected by the lack of food, the lack of health care, additional enforcement around immigration. Um, and so we want to also recognize and understand many churches and faith communities are already doing much, right? Many churches lead in having food banks that are important and vital resources for people in hunger within their communities, are pushing for clinics and other health facilities in underserved communities, right? Even just within this webinar, folks have shared how they're partnering with other churches from in other communities in order to make sure that they are covering each other as different communities are being targeted, right, by the state. And so we want to make sure that we are also foregrounding the ways in which we are directly able to help people and intervene where needed. Oh, sorry. Um, so yeah. And these changes to our programs, we want to make sure that people are going to need the help they need in order to get healthcare and food. We can some things that we can also do as faith leaders is partnering with and counseling people through the process who may otherwise struggle to navigate with the changes. So I also want to lift up even just today, I want to say there was a story from the Kaiser Family Foundation, which walked through the way in which someone who was had worked as a social worker had trouble navigating the new work requirements in the Georgia Medicaid program. And so this was one of the first programs in one of the programs in which national legislators pointed to say that these work requirements and these changes could work. And so if people who have done this for a living are already having trouble in the places that are supposed to be held up as the ideal, then we can only imagine how it's going to affect people in places where it's not as much careful attention being paid, and they may not have as much expertise, right? And so, as faith leaders, as people with resources, we want to make sure that we're giving people as much information as they possibly can, as much assistance as they possibly can, as they navigate some of these new things. So, here's some of the information. Medicaid beneficiaries will have to recertify at least every 6 months instead of once a year. So this is just beginning. They have to show they're working or volunteer 80 hours a month. Um, some states may add more requirements for people who are needing benefits, and so we also need to make sure we're engaging at the state level when these ideas are being proposed. And people with mental illnesses or without housing may be particularly vulnerable to these changes as additional reporting requirements requires them to have documents that they often may not have or are often out of date as they are forced to move from place to place. And we want to make sure we're talking to everyone and helping them to adjust to these changes as much as possible, so that we just make sure that we are showing up in our community as faithfully as possible. How else can we help? So, wanting to open up some space in the chat, and you can voice it in the room as well. Things that we can think around as these changes are coming down. If we are, uh, able to create programs at our churches, can we create volunteer opportunities so that people can have opportunities to have access to healthcare? What are the things that we need in order to accommodate people? And some of the things that we can do in order to intervene when they may have a roadblock. I do want to pause there because again, I've done a lot of talking. And anybody in the chat that's thinking through ways in which we can help people as changes to Medicaid happen, really would love to hear them and voice them. And again, this is something that's going to be recorded, and we're going to share this out over the internet. So who knows where some of these ideas may lead. So I'm just going to pause there. All right. Feel free to jump in as I'm talking, as I lift up the one that's lifted here on the slide with constituent services. So, not many people may know that every elected office has staff dedicated to helping people navigate um, particularly thorny issues with either the local, state, or federal agencies. And so, if you are having a problem, you can call your local representative, you can call your local state rep, you can call your local council person, tell them you're having a problem, and then they'll walk you through a process with a constituent services representative who can hopefully either walk you through where the issue is on your end, if that is the case, or if there's an issue on the agencies in, then they can follow up on that and see what's actually happening. I'll say, when I was working as a constituent services rep, 9 times out of 10, the problem was sitting on someone's desk without being able to be addressed. So that's one way in which we can help people out is connecting them to to those services. I'm seeing in the chat here that Mary Lou says we can have retired nurses in our community and they can do screenings. That's a great idea. Bringing more people into the process and then bringing people with skills that can be really helpful to neighbors is like a really good, useful, and creative idea. I really like that. Thank you, Mary Lou. You
As
came
a
out.
retired nurse, I would say be careful and make sure that each state has its own board of nursing and scope of practice. So just make sure that if you're having screening at your church, you understand the scope of practice of the nurse in that state and in that community. Because I started my ministry in health ministry many, many moons ago.
Yeah.
That's
And
a great.
and if you have a local institution near you and maybe trains nurses, teaches nurses, what would it look like, to approach the leaders of that institution and ask them, hey, we may have this need in the community. What would it look like in order to partner on a community program? So we just want to make sure that we're thinking creatively as we approach some of these issues. And again, we're going to continue these conversations within our mighty networks and in one-on-one conversations as we move forward. So I just want to make sure to emphasize that as well.
Awesome.
All
So looking at SNAP, these new changes aren't just about budgets. They're about whether families can eat. It means the state will take on more costs for the program, affecting the number of people they can serve. So if their budget doesn't have enough money, there's going to be less families to eat. But with tighter rules, we can expect to see additional requirements and reporting rules. And similar to Medicaid, we want to make sure we're doing everything we can to advocate when these changes are being discussed and adjust to any changes that occur. So this says this here right here, the extension of the 3-month time limit to people 55 to 65 will affect families overall. So one change that might fly under the radar but has deep impact is the expansion of the 3-month time limit to adults 55 to 65. What that means is, unless someone in that age group meets strict work requirements or qualifies for an exemption, they can only receive SNAP for 3 months every 3 years. We're talking about folks who may be caring for grandchildren or aging spouses, people with chronic health conditions, mental health issues, those laid off and struggling to work. What about our federal workers? All these people are going to be affected by this. And right now, as programs like food drives and regular outreach to people without housing can be critical at this time. This is the time for the church to really lean in. We also want to make sure that institutions like schools and libraries can offer as much help feeding people as possible. And it's important as the church, we have to remember we don't know how to do everything. So it's important that we plug in with local organizations that are already doing this work, that are experienced, and aid in logistics to stretch the church's resources. Sometimes it just means we get the people to the resources, drive them to get it, because they just can't get there because they don't have a car.
Oh, my bad. Sorry. Thank you. Really great. And yeah, once again, opening up to what are other ways we can help, right? Could it be something like holding a community meal so that people don't feel any stigma around coming out and being able to access food that they may not otherwise have access to, right? Could it be a potluck with, making sure people know that all cooking isn't for everyone, but making sure that people are always being able to be fed. So yeah, any other ideas folks can think of? The church can create jobs. Thank you, Mary Luke, for some of the people so they can work enough to qualify for benefits. Yeah, if there's a strategy budget for it and there's a need, then that could be a great idea. And really wanting to emphasize again a lot of that creative thinking. And then I also want to emphasize that we are going to continue having this conversation through Mighty Networks, right? So that we can, as people are building out different ways to respond, we can see and learn from each other, but we can also lift those up and show again that people care about this and people are acting to intervene directly. So I'm going to leave with some following questions here. What are the people doing in your area to adapt already, right? A lot of you have already mentioned how you're already plugged in with a lot of different organizations that are already moving. Think through what are you doing in your community, how you're showing up in your community, and what you would like to see. And then, yeah, let's just pause there because I want to make sure that folks have the opportunity to voice the things that they're doing, the things that they're seeing. But then I also want to make sure to lift up and then make sure to have people on the lookout for that Mighty Networks invite.
I like to share my church. We have a food bank that goes out every month. We're downtown District Columbia, and we have a food bank for non-perishables. But we also have a partnership with an organization that brings fresh produce every month. I mean, collard greens, fruit, vegetables. Our boardroom is full of food, and then we have a group of volunteers that drive these to people. And then we have a ministry where ministers call the food bank people and pray with them, see if they need anything. So sometimes it doesn't have to be super deep, but it might be just that extra step to make sure that they're getting healthy foods because of the food deserts that we see.
Yeah, no, that's awesome, and I'm really glad you emphasized that it doesn't have to be super deep, but it can be some of these small things that we can offer to provide people. I'm seeing in the chat, Joan saying that churches could provide long-term planning goals to accommodate folks in need during critical time. No, I think that would be amazing, and I think that would be a major reorientation of the way a lot of churches do some of the long-term planning, and I think there'll be a really good way in order to kind of lift up to the community the way that the church is in service to the community. So, no, I think that's a great answer. Says undue medical debt buys delinquent medical debts for pennies on the dollar. So these organizations that again are helping people directly are really important, and so it's really important to plug in there. So thank you, Stephen. A few more things that I want to share. Tomorrow, the National Council of Churches is having a call, a webinar around these issues again around Medicaid and SNAP and the moral need for advocacy. So that's an action I want to lift up, and I'll make sure to share. I also want to make sure to share out that there are a lot of actions happening around in the direct service or in direct response to things that are happening with immigration through organizations nationally that I'll make sure to share as well. And some other resources that are happening with national organizations. But I do want to make sure to emphasize and hopefully be able to work with you all in order to get a good understanding of what's happening in your communities locally as well. So I'm going to pause there one more time just to make sure that makes sense. And give anybody else the opportunity to put their voice in the room that hasn't had an opportunity to do so.
And Chad, I want to put a plug for Mighty Networks because this is a place, it's basically an online hub where we can communicate, we can have resources. There'll be a library of all the things we talked about. You'll be able to grab it and share it and all of that. So I hope that you'll sign up and take advantage of this in your communities.
Yep. These slides are already there. This recording will be there. And then the resources that we're discussing, not only will I make sure to send it to your email, but they'll also live there as well. And we'll also have an ongoing conversation. So many of the questions you're seeing here, we'll have a ongoing, living, breathing conversation there at Mighty Networks so that everyone can participate. And yeah, we can make sure that we are learning from each other and building power with each other together.
And Chad, I want to make sure folks know that we're going to have our next webinar the second Tuesday of September. I can't believe it's September. Um, which is September the 9th at
Yep.
7 p.m. So just put that in your calendars. You'll find out more information, but we're going to have several different topics and share it with others so that we can have a robust conversation.
Yes, please. I really, really, really appreciate everybody coming. Please be on the lookout for the follow-up email. It should come in tomorrow morning. And there's going to be a form for feedback. Would love to make sure we get that as well. Want to make sure that we are speaking to the things that you all need. And I really appreciate, I understand, it's 7 p.m. Eastern Standard Time here. People are calling in from all over the country. And, I know your time and intention is precious. So I really appreciate you all taking the time to join us today. And I really look forward to working with you all and talking with you all as we continue to work and try and make sure that we are living our faith in a way that is true to us. Okay, I got you, Mary Lou. We'll make sure to keep on putting it online as well. All right. All right, everybody. Have a good one.